cognitive behavioral therapy can be a great way to treat mental health disorders such as anxiety, depression, anger, even bipolar disorder or mood swings. So, in cognitive behavioral therapy, it's believed that just by changing the way one is thinking, that can change the way they feel and the way they behave. So, the first step in cognitive behavioral therapy is to try to identify the thoughts that one is having. And it's by identifying one's thoughts, one can examine whether or not there's a negative or positive association to them, if they're accurate or inaccurate, they're realistic or unrealistic, etc. So, there are common mistakes that people do when thinking about a situation. One mistake is that they focus on the negative. And so if they focus on the negative, they're going to be more likely to have negative feelings or negative behavior patterns associated with it. Anxiety, depressed, pessimistic, hopeless, even causing someone to isolate or lose enjoyment in life. That's one common mistake. A second common mistake is minimizing the positive. Not only would minimizing the positive make it difficult to feel good things, but also it'll make it more likely that negative things, negative thoughts, negative feelings will affect that person. So first we have focus on the negative. Two is minimizing the positive. So those are some common mistakes people get themselves into. Third is making a general statement for all events. For example, one may think that just because their parents got upset at them for doing this, that would happen in the future as well if they did the same thing. So they make a general statement for all events. A fourth is jumping to conclusions. This can also be known as automatic thoughts. And so what happens is your thoughts may go quickly to something even when there's not necessarily associated with it. For example, giving someone a call or text and they're not responding right away. So you automatically jump to certain thoughts like maybe something bad happened to them, or maybe they don't like me, or something like that. Next is mind reading. Thinking you know why people are acting a certain way when really you may not know. Maybe they're going through some issues that you don't know about and that's why they're acting that way. Another common thought problem that people have is blaming. They put too much blame on someone else and they don't take any responsibility for their actions. Another thing is like the opposite of that is more personalization. They put too much blame or they identify themselves too much with the problem and they don't make excuses for maybe what the other person is going through. Or conversely, they compare themselves too much to others. So there's several common mistakes that people make, and these are just some of them. So the first step in cognitive therapy is really to identify the thoughts that one is having in these situations that are causing distress. And so sometimes you may need to start from the feelings that are not wanted, like maybe anxiety, depression, or anger, and try to identify what thoughts are happening during that time that may be contributing. Conversely, you can look at the behaviors. If someone notices they're getting angry or yelling or getting in this pattern that they don't want to get into, they could try to examine what thoughts they're having. Are the thoughts they're having contributing to any of these certain things? So, for example, is a manager really giving you a difficult time at work? Or perhaps the manager is reacting this way because you've had previous experiences with managers and they were acting that way, and so you sort of make this general statement in your head that they're going to act that way too, and it can actually replay that scenario in real life. Another way is your spouse really being difficult on you, or are you just failing to look at the positive qualities of the spouse and just focusing on the negative, which seems to magnify that issue? So for example, any situation can really be seen in a positive way. For example, if you take a glass of water, is it half full or is it half empty? Well, there's both water and there's both empty without water. But someone who's thinking incorrectly may take a similar scenario and have a difficult time seeing the water in the cup, or maybe they'll just focus on the emptiness or negativity. Maybe they'll give you a different answer altogether. Maybe they'll say, oh, the water is made of elements, including H2O, and therefore it comes from, and then just go blah, 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 and something that's not related. So you can imagine if you just take the simple or basic example of water in a cup, how this can be thwarted or changed if someone thinks about the events or what's happening in their life around them, what's going on in school or work, etc. Not only this will affect one's thoughts, but it's going to affect their feelings as well, and one's behaviors will closely follow that path as well. For instance, if one thinks their boss or supervisor are being harsh on them, they may cause them to try to find a different job or go to their HR department complaining about their boss. Believe it or not, this can all be affected just by one's perception or the power of the mind, whether or not it's realistic. So what other reasons could be cognitive evaluating the thoughts be important? People who are anxious tend to focus on the negative and minimize the positive, or have an intense fear of physical or psychological danger, even if there's no danger present. People who are depressed may have a negative view about themselves or an experience, or view their future negatively. This can all be changed through cognitive behavioral therapy. People who are bipolar may have an inflated view of themselves, their experience, or their future. And often they can get with this because they have low self-esteem and just trying to think highly of themselves, even too highly, to sort of compensate for that low self-esteem. People who are intensely fear of being fat or overweight can develop eating disorders such as anorexia. Someone who is paranoid may have a tendency to jump to negative conclusions even before an event happens. So the mind is very powerful. It's powerful to be aware of one's thoughts and what they consist of. Depressed thoughts lead to depressed feelings, may cause one to isolate or withdraw. Anxious thoughts can lead to anxious feelings, which can lead one to isolate, be on guard, or get really snappy or irritable. So the first step in cognitive therapy is to identify the incorrect thoughts. If you want to look up more about this, it was first discovered by Dr. Beck in the 1970s. They also constructed many scales that can help identify some symptoms of anxiety or depression. In short, the number one step in cognitive therapy is identifying the thoughts one can happen that may be contributing to the mental disease. You may have to work backwards, such as recalling a strong negative feeling in the situation and what thoughts may have led to it. Or perhaps you have to recall a negative behavior, such as yelling, anger, maybe a panic attack or an extreme sense of sadness, and what thoughts have contributed to those events. Be sure to like this video and subscribe to the channel. If you already think you got the hang of it and want to get down to the full cognitive behavioral therapy worksheet, you can check out my other video about a practical guide walking you through a CBT worksheet.